it's DeVonna, and welcome to S.C.A.L.E, Sickle Cell Awareness and Lifestyle Empowerment. It's Tuesday, so for this Tuesday talk, I recently had an interview with my hematologist, Dr. McNeer, at Edward Hospital, and I sat down with her to ask her a little bit about herself and her point of view on sickle cell. So here it is.
Hi, I'm Dr. Jennifer McNeer. I'm a pediatric hematologist and oncologist with Comer Children's Hospital at the University of Chicago.
And we are here asking Dr. McNeer some questions to get the doctor's perspective on the things of sickle cell. So the first question is, what motivated you to start a career in hematology?
That's a good question. So when I went into medical school, I always felt like I would be a pediatrician. Initially, I thought I would be a general pediatrician, but as I started to learn more about medicine, I realized that I really enjoyed the subspecialties more. I always really enjoyed hematology looking back. In the years before we started our clinical rotations, I loved learning about the blood cells and what they did and the immune system and how it functioned. And then as I got into my pediatrics residency, I actually had never experienced pediatric hematology and oncology before, but as I did those rotations, I realized I really enjoyed taking care of a patient population who needed subspecialty care, and there was some outpatient care and there was some inpatient care, but that we also had continuity with our families, so we really got to take care of children over the course of their lives and had the tight bond that pediatricians have with their patients, but still in a subspecialty field.
Okay. Question number 2. So can you explain to the viewers what exactly is going on in the body of a person with sickle cell?
Sure. So in somebody who has sickle cell disease, there's an abnormality in the genes that code for the red blood cells, such that when the red blood cells are stressed, instead of being round and donut shaped more or less and very flexible, they become sickle shaped or crescent shaped. And that means that those blood cells, when they are crescent shaped, can get caught up in some of the small blood vessels. And so that is what leads to some of the problems that patients with sickle cell disease can develop, such as pain crises, something called acute chest syndrome, or strokes, and other problems like that.
Okay. Next question. What is a common challenge you faced when dealing with sickle cell patients?
I think what is probably most hard for patients who have sickle cell disease is the pain, because children, adolescents, young adults who have sickle cell disease, they unfortunately do have to live with pain, not necessarily every day, but not infrequently. And I think that can really compromise their quality of life and their ability to do sports and clubs and other activities that they want to do, hang out with their friends and so on. And I think that's really a challenge to figure out how we can help these patients lessen the amount of pain that they're experiencing, stay out of the hospital as much as they can, and really optimize that quality of life.
Great. How has the medical field advanced with their research in finding cures and improving treatments?
Well, if we're talking specifically about sickle cell disease, I think we have a couple of big advances. Young children who have sickle cell disease, we start on penicillin prophylaxis in order to help prevent infections. We do screening ultrasounds called transcranial Doppler ultrasounds over time to look for children who may be at higher risk of stroke, and we start putting them on chronic transfusion regimens to minimize that risk. Hydroxyurea has been wonderful. It helps to raise the hemoglobin. It helps to raise the amount of what's called fetal hemoglobin in the red blood cells to make it less likely that the cells will sickle. And so there are fewer pain crises, fewer episodes of acute chest. We hope with time that there will be less end organ damage, meaning kidney problems, liver problems, lung problems, eye problems over time. And then certainly what is very exciting now is the advancements in the field in terms of bone marrow transplantation, which is really the one curative therapy for sickle cell disease. Not all patients can undergo transplant. There has to be a donor that matches those patients available. There's a lot of research in that area to try and expand the possible donor pool for patients. And I think what's probably going to be coming down the horizon at some point is going to be gene therapy. There's a single gene defect that causes sickle cell disease, and if we can find a way to do gene therapy safely for patients, that is potentially another cure for sickle cell disease. So I think that there are a lot of exciting advancements that have happened and a lot more to come.
Very interesting. Do you see the life expectancy for the sickle cell majority increasing?
We have, thankfully. So we have certainly seen the life expectancy increase over time. A lot of that has to do with some of these things that we just talked about: penicillin prophylaxis to prevent infections, screening for risk of strokes, and so on. And I think just having good continuity of care. So all patients with sickle cell disease to see a hematologist on a regular basis, make sure that they're getting the proper well child and subsequently well adult follow-up that they need in order to optimize their health.
Okay. What are some foods that are beneficial to the health of sickle cell patients?
I can't say that there's anything in particular other than a good, well-rounded diet. So protein, grains, lots of fruits and vegetables, lots of water. Staying hydrated is really important, so just general healthy eating.
Okay. What precautions should an individual with sickle cell take when participating in physical activities?
So hydration is probably the most important aspect. So making sure that you're staying very well hydrated before, during, and after your activities. If your activity is something that's going to take place outside, making sure you're dressed properly for the weather, and not letting your body get too cold or too hot and dehydrated.
And the last question, what overall advice do you have for those dealing with sickle cell?
I think have a positive outlook. There are a lot of screenings we can do to optimize health. There are interventions we have to improve quality of life in terms of pain and minimize hospitalization. I think it's really important to connect with other people who have sickle cell disease and other families who have sickle cell disease, so that way you have somebody who truly understands what you're going through. And there are ways to meet those families through various sickle cell organizations. There are some walks that happen, which are great opportunities for families to connect and really support, become a support network for one another.
Great, thank you.
You're very welcome. This was my pleasure.
Thank you so much for watching this video. If you enjoyed it, don't forget to click that like button for me. Also, I'd love to get some feedback and see what you thought of this video. So comment in the comment section below. And also, if you want to learn more about sickle cell and come along with me on my sickle cell journey, don't forget to subscribe. See you guys next time. Bye.